Hi, my name is Aaron Mack. I'm an advanced EMT with Johnston County Emergency Services EMS Division, and I'm here today to talk to you about what we do in EMS and the ambulance, and go over a few things and just kind of introduce you to how EMS works, what we do on a daily basis. So let me let you in here real quick. EMS Division works in 4 shifts of 24 hours. We work 24 on, 72 off, and this is our office. Every day we come in, we check off the truck, make sure our medical equipment is in working order, that we have bare minimum PAR levels in order to serve the people of Johnston County, and we clean the ambulance from top to bottom to make sure that it is disinfected for every one of our patients. We do that in between every single call, before our shift and after our shift, and we check off all of our medical equipment. If you want to step inside, I'll show you what we do. So here we are in the what we call the box area, or the patient care compartment of the ambulance, and as you can see, there is very limited space, so we try to have everything in proper places. Our ambulances are all set up very similarly, so that way if you are working on a different unit than you're normally assigned to, you can still find all of your medical equipment. When we come in the morning, we check all of this off. Every single one of these cabinets is opened, the stuff is pulled out, we go through PAR levels, we make sure that we have the equipment necessary to run any call we could possibly run into. And Johnston County is a decently sized county. We ran just under 28,000 calls last year in a pretty decently wide square mileage area. Johnston County has urban to rural areas that we all respond to. So we have to carry a multitude of different pieces of equipment on the ambulance in order to service all of those calls. So let's look at some of the bags and the equipment that we use pretty much every day on an ambulance. So this is our stretcher, and everything in the cabinets that I talked about earlier is duplicated on the stretcher, so that way we can take this to our patient in order to render care quickly, and then return to the ambulance when necessary for more equipment or more advanced equipment or specialty equipment. So we're just going to talk about these 3 bags and this monitor here today, because the rest of it's kind of redundant. So first off, our monitor here is a Zoll X series. Pretty advanced monitor. Allows us to take vital signs like a blood pressure or heart rate, as well as read oxygen levels in the saturation of your blood, as well as do more advanced techniques like take a 12 lead or look at a picture of your heart, as well as defibrillate someone who's in cardiac arrest. So a very important piece of equipment that we check off every single day. The next bag we have here is what we call our go bag. We recently implemented this due to restrictions from the recent viral outbreak, and this has some pretty quick vital taking equipment as well, including a thermometer, a glucometer, fast med bag that may be used to stabilize a patient pretty quickly or give a first line medication. And then in the back part here, we have supplies to start IVs, to deal with hypoglycemia or low blood sugar, as well as some trauma supplies and some more vital taking information. The next bag we have is this green one, which is our airway bag. This is going to hold our oxygen, as well as what we call airway adjuncts, which help stabilize airways, so that way we can help people who have breathing problems. Including nebulizer kits, nasal cannulas, the little prongs that go up in your nose, full masks, as well as more advanced techniques like supraglottic airways, which are for cardiac arrest, which go all the way down to the throat, or CPAP, which is continuous pressure oxygen that goes across your face in a mask. And all of those are here in this bag. Also gets checked off every morning. Our Black Hawk bag, or our primary bag, has a lot of pockets that we have to check off, but you'll notice some redundancy from our go bag, some trauma supplies, some more vital taking stuff, tourniquet for major bleeding, and then in the bottom here we have our intubation kit, which is going to go along with our airway bag in order to place tubes in patients that require secured airways, as well as our pack of medications, which we have quite a few of, as you can see. And these are designed to handle a multitude of medical emergencies. And our IV kit to establish IVs on scene. Like I said, every day we check this off and make sure we can run calls in this county and effectively help the citizens. In the EMS division, we respond to a multitude of calls that are triaged with emergency medical dispatch. When you call 911, they triage what you tell them, where you are, how to respond, and who needs to respond to those calls. Based on this information, EMS could respond with lights and sirens above the posted speed limit, or could respond in a routine manner following all normal traffic safety laws. In the EMS division, we do have requirements that allow us to respond in a advanced or faster speed. However, that does not mean that we can break traffic laws whenever we feel like it. However, if you see someone driving around with lights and sirens on, try to move over and allow that emergency vehicle to pass you and respond to those calls, because you don't know what's going on. But we also have a CAD system through this computer, which allows us to see where our call is, gives us information on that, on the call type, what kind of triage has been done, and just some generalized information so we can pre-plan our call prior to our arrival. Well, thank you for joining me today. If EMS sounds like an interesting career to you, just know that we're very fast-paced. We're on the cutting edge of medical technology. If you're a younger student between the ages of 16 and 18, you find this interesting, you want to know more, we do offer a cadet program where you can come right along, learn what EMS is about. If you're older, 18, this looks like a career that you want to start into, because it is a place where you can advance, move forward. Contact your local community college and see if they offer a course. JCC offers several, from the EMT, AEMT, up to the paramedic level program. Again, thank you for coming and hanging out with us today.